Good morning, everyone. I'm Rahul Nanuhal, COO at Cureka.com. And we are back today with our weekly Instagram live session with a specialist doctor to help you understand some of the concerns, diagnosis, and treatments about a particular problem. Last week we discussed about infant health. Today we are going to discuss about ear pain, which is a very common topic. A lot of people today, they suffer from ear pain and do not know what to do about it. So it's a day-to-day issue with many people, and some people have got a chronic ear pain problem, which makes it very uncomfortable for them to travel or to work or to do any activity. So a very specialist doctor is going to join us today, Dr. Berenice Stella, who is an ENT surgeon, and she is going to help us with understanding how we could live better with ear pain by preventing it and treating it better. In the meantime, I would request you to. Hi, good morning, Dr. Stella. How are you?
Good morning. I'm fine.
Wonderful, and thank you so much for joining us today. It has been a pleasure to host you.
Sure.
So, doctor, today we are going to cover the topic for the ear pain. Before we start, I would request all our listeners and guests who are joining in now that if you have got any questions around ear pain, please put it down in the comment section below, and we will try to take them during this live session. Even let's say the session gets over and we are not able to take your message, after the Instagram live session is over, we will come back to you with the doctor's response on your message. So doctor, let's get started. So doctor, what are the causes of ear pain?
So here we have been talking, I think whoever is new, I just want to say that hi. And we were talking about nose so far, and today is the first day we are talking about the ear. Ear is a very sensitive organ, and not only hearing, it has other important functions like it maintains our balance when we walk. Many people are not aware of it, but our balance is mainly dependent on the inner ear. So that's it with the introduction. So I'll come to the causes of ear pain right now. So ear pain can be because of very simple reasons like trauma. Trauma means when you put your finger and scratch, the fingernails can scratch the ear, can cause ear pain. Or we use earbuds. Some people have the habit of using hairpin and safety pin and keys, pen. So that can cause trauma, can cause ear pain. So these are the traumatic causes. There are other infective causes which we come across in the ENT hospital clinic setup. That is when the patient has ear infection, can be because of the infection from the nose or from the ear per se. And it can also be because of any tumors, cancer we say, that can also come in the ear. So since I said ear is like the external ear is like a tube-like structure, and it does not have much fat. So there is skin and there is bone immediately underneath. So any small scratch, it definitely immediately goes to the underlying bone. So that is why ear pain is intolerable, and it is most worse during the night. So that is why patients suddenly come with severe ear pain, so which has to be immediately attended by a doctor and treated very early so that we don't get complications.
Understood. Okay. So doctor, how can we determine if the ear pain is related to an ear infection?
So like I said, if sometimes many of the patients come to me and they say ear pain, and then the first question I asked is, are you using any earbuds? And most of them say yes. So that rules out if it is because of a trauma. Sometimes the ear pain is infective. How do we know? We have a common cold or any infection in the nose, they get common cold. And then 2 days later, they get that mild ear pain but suddenly during sleep, they wake up with severe ear pain, and then one day later, there is ear discharge. Sometimes it can be sticky and it can smell. So, ear discharge is a classical sign of ear infection, along with ear pain, which is usually coming after an episode of common cold, or when we scratch the ears and it becomes infected over 2 or 3 days time, then also we can have the same symptoms, ear pain with ear discharge. And if you're not attending it for like a week or 3 weeks, then we can develop hearing loss also. So infective causes of ear pain are mainly because the clue is ear discharge. Ear discharge is okay.
Okay. And doctor, what are the symptoms of ear infection?
So ear infection, like I said again, ear discharge, hearing loss. Then there's something called as tinnitus. We call it as tinnitus. That is a medical term. The layman term is ringing sensation of the ear. So the patient say, I feel like someone is whistling into my ear. So that is because of any problem with the eardrum. When the eardrum is infected, it can either retract inside or it can perforate, it can make a hole so that the pus behind can come out, relieve the pressure. So that kind of hole in the drum can cause tinnitus, that is a ringing sensation. So these are the symptoms of an infective cause of ear pain.
Okay. So, doctor, now should a person be concerned if his ear pain is accompanied by fever?
Has to be, because, so a little more about the ear before I answer this question. Why are we bothered about the ear pain a lot? So a little about the structure of the human ear. We have the external ear where we normally put the buds and all, that is the external ear. Then comes the eardrum. Then behind the eardrum, what we call is the middle ear, has very small holes which move and that help in the sound mechanism. And behind that is the inner ear, which is very close to our brain. So,
Okay. So I believe doctor's internet is an issue. She'll be back very soon. So in the meantime, let me tell you more about what we do at Cureka. Cureka is a online and now we have physical stores also, healthcare platform where we have got products from more than 9 different categories. Cureka started by a team of doctors who are expert dermatologists and orthopedic surgeons. And the vision of the founders of Cureka is to, build a healthy India. So today what we see is a lot of people are confused as to what kind of products are good for them for a general healthy living. If you go to any online store, generic store, or you go to a physical, let's say a pharmacy or let's say a supermarket, you do not know if the product in front of you is good for you or not. But at Cureka, you can be rest assured that these products are handpicked by a team of doctors and you do not need to worry whether that product is good for you or not. Specifically, there's some products which are there for certain concerns specific. So if you want to be very sure of what product is good for you, do get in touch with our experts by WhatsApp platform. We've got free of cost WhatsApp platform where you can connect for free with our panel of doctors through our customer care experts, and we will get back to you within few hours. So this will allow you to directly understand what are the best fit products for your concern. I believe the doctor is going to be live. Yeah. Welcome back, doctor. I believe there was an internet issue. Yeah. So let's continue. So you were talking about ear pain, which is accompanied by fever.
Yeah. So I think half of it, because of the network connection, I couldn't say. So ear pain, when it is becoming severe or when it is going little deeper, then it causes fever. So little deeper in the sense we are talking about the structures behind the ear and basically close to the brain. So anybody who has a ear pain and later on they develop fever, has to come to a doctor. If the patient is a small child, if the patient is a elderly person, especially if the person has diabetes, please come to an ENT doctor and get it sorted out before it reaches your brain and cause brain fever, I would say.
Right. I'm sure that is going to help a lot of people who are not aware what to do when the pain is accompanied by a fever. Right. So how can, in general, people get relieved of the pain in the ear?
So pain in the ear can be as simple as some people can have pain in the ear when they fly. So that is because of the pressure change. So when they ascend, suddenly there is a change in the pressure. So that time what our eardrums does is it tries to retract inside. So that structure, when it forcibly retracts inside, we have a lot of pain. So that can be easily managed by chewing. Just put something in your mouth, keep chewing. So the chewing movement of the mouth gives a lot of air to the eardrum, which makes the eardrum again back to its normal position. That can be treated simply like that. But other causes of ear pain, which is because of a trauma or because of an accident or because they have an infection, some discharge, they have to see a doctor. That has to be seen, sorted out, given medicines, and then only it can be cured.
Understood. I could relate this to, when we are flying also, air hostesses, they do tell us, okay, you start chewing something that will relieve you of the pain, when you're, boarding or then when the flight is coming down, right? So, okay, now a lot of people ask a question that there are a lot of over-the-counter drugs or ear drops available. Should anyone go with any over-the-counter ear drops to relieve themselves of the pain?
So, over-the-counter drugs, I think most of us will be against over-the-counter drugs. And especially as an ENT surgeon, the ear, we only have very few ear drops, but there are some combination drops which contains steroid also, which should not be given for the patient. So that over the counter, I would advise not to go. The other thing is, in little ancient times, maybe 10-15 years, there were certain antibiotic drops that were given. Basically, they are damaging the ear nerves. So without a doctor's advice or a supervision, if the patient just takes such kind of ear drops from the pharmacy and using for a long time, they can actually lose their hearing without even knowing. So I would say when it comes to the ear, it is better to get checked and take a prescription from a doctor rather than taking over-the-counter drugs for the ear.
Understood. So, doctor, okay, that was about over-the-counter drugs, but what about the home remedies? So, can people, take any home remedies that can help them with the ear pain?
So, we talk about home remedies. So, there is the kind of ear pain where we get following common cold, or people who have sinusitis can also develop ear pain. But the same mechanism that the eardrum actually tries to retract when there is no ventilation from the nose, because nose has already another problem, that is sinusitis. Such people's ear pain can be relieved with steam inhalation. They can inhale steam at home, which goes through the nose, and it kind of relieves the eardrum. That's the only home remedy we can actually use. There have been other home remedies which I have seen in my practice are instilling oil drops and keeping ginger and garlic into the nose. Please do not use such things. It can damage your nose, your ear skin, and can actually lead you to serious effects. So anything through the nose cannot be taken, but through the nose, steam inhalation will help ear pain to some extent. That's the only home remedy I can think of.
Okay. So we've got a question coming in from Arun. He says, "Hi ma'am, I have children below 2 years. If they cry at night sleep due to ear pain, how to identify?" And I believe he also would like to understand how to treat them in that case at home.
usually what happens to children is this nose taking air through the nose and giving it to the ear drum for the ventilation does not happen as good as the adults. So when they have, children frequently get infection of the nose. So what happens, because of the nasal discharge, the air through the nose is not going to the ear. So when they sleep, that becomes worse. The eardrum keeps going back and back and back, and that causes pain. So what happens, a child goes to sleep normally, and then around 2 or 3 hours of sleep suddenly wakes up with severe crying pain. But what happens is, it is actually nature that God has created. The moment the child starts crying, the child takes a lot of air through the nose and the mouth, and automatically the pain relieves. But even if the pain is not relieving, then you have to bring the child to a doctor immediately, I would say in the night itself, so that the ear has to be checked. The ear has to be checked. Sometimes the eardrum can be bulging with a lot of discharge behind, which has to be treated immediately. Sometimes we even admit the child and start on IV antibiotics. So how do you identify if the child is crying of pain in the night? This is the classic scenario. A common cold for 2 to 3 days which is not being treated properly, and the child goes to sleep in the night. 1 or 2 hours after sleep, the child wakes up with severe crying episode, pointing their hands to the ears. That is classically because of an ear infection.
Understood. Okay, so now a lot of people want to know that, okay, when they start getting ear pain, and let's say whether it's even a mild pain, should they go and consult a doctor?
Again, I'll come back from the basics. If it is a small child, if it is an elderly person, and if the patient has other comorbidities like diabetes or some other problem, if they are a cancer patient and they are on multiple chemotherapy drugs, then these kind of patients should come to a doctor even if it is a mild pain. But otherwise, if you're talking about healthy toddlers, young adults, or adults with no issues, mild pain, they can actually try the steam inhalation. And if their pain persists more than a week, along with hearing loss, and if they see some discharge, they have to see a doctor.
Okay. Okay. So now a lot of people ask question, doctor. So could the ear pain be a sign of some serious condition?
Like
serious medical condition?
There are certain tumors that can cause ear pain also. So like in every other part of our body, even the ear can have tumors, cancers that can cause ear pain. And like I said just now, if the patients are immunocompromised, so how would I say this? So they will not have immunity like us. For example, diabetic patients or patients on a long-term treatment for some other problem, they are in and out of hospitals with multiple medications. For them, the immunity is very low. Such patients can actually aggravate a very small, maybe they put some butts in the ear and then they could have actually traumatized it very badly, and they can actually end up with ear pain. Such patients should be seen very carefully. But otherwise, ear pain basically signifies mostly it is an infection, or very rarely it's a malignancy, tumor.
Okay, all right. So now the next question is, so doctor, is it safe to fly if one person has a ear pain?
I think I would say, because flying is mandatory, I think nowadays most of us fly everywhere because it reduces a lot of time. So, but there are a group of patients, for example, the ones that we operate on the ear, and then we tell those patients that for the next 3 months, immediately after surgery, you cannot fly, because we repair the eardrum and it is not like a normal eardrum, it is very sensitive. Such patients, if they fly, the drum takes a lot of negative pressure and goes back. Sometimes it can perforate, it can give away. So such patients should not fly. I'm talking about the post-operative patients. But other patients who frequently have ear pain, if they fly, they actually have to take a lot of precautions, like carry a lot of chewing gums, or a flask of warm water where they can actually drink small sips in between so that it relieves the pressure, or they can chew something, keep some ear plugs in the ear. All those can be done. But if the patient have been operated recently in the ear, I would say no to flights for 3 weeks, 3 months.
Okay, right. So, doctor, we have got a question coming in from a listener, Bhuvneshwari, who says, my 5-year-old baby girl during cold season often complain ear pain at night, and the next day gets fever or cold and cough. So, what precautions should she take to avoid that?
Okay. So this 5-year-old is a very classical age for a problem called as adenoid. So adenoids are a group of tissue which are behind the nose, and just like tonsils we can see through the mouth, but adenoids are behind the nose. So this up to 7 years of age, these kids have this adenoids are bigger for them. So what they do is they do not let the air from the nose reach the ears. So there is always a shortage of air for the ears. So any small infection, any climate change, immediately their eardrum gets at negative pressure, retracts, gives them a lot of pain, and there's fluid behind the drum. Mostly it is not because of the ear, but it is because of the adenoids. So if your child has such problem, please consult a doctor. There are ways to identify adenoids. For example, we can do an X-ray, or we can even just examine through an endoscope. If he or she has a big adenoids and causing frequent problems to the ear, then that has to be treated before treating the ears.
Understood. Understood. So, doctor, can ear pain be a sign of allergies?
Yes, ear pain can be a sign of allergies. I would say more of ear itching is a sign of allergy, because just like the previous talk, itching in the nose, itching in the eyes, and itching in the throat and the ears, they are a combination of allergy. But on a patient who has a chronic allergy, would say over the years, so their drum again retracts back because of the negative pressure, such patients can have ear pain on a long-standing allergy patient.
Okay. Okay. Understood. Right. So, what test will the doctor in general perform, doctor, to diagnose the cause of ear pain?
So ear pain is we diagnose mainly by history. We talk to the patient a lot. We found out how the symptoms have started and what are the symptoms they have. I would say it is mostly this thing. And we have a small instrument in our hands. We call this an otoscope, through which we see the ears. So this basically diagnoses all our ear problems. And apart from this, we also have another test where the integrity of the eardrum is being tested. How strong it is, how bad it is going back, or it is not moving, it is very stiff. So that we call it as tympanometry. That is being done by the audiology team. Those are the tests we do. And if they have a lot of discharge and years of complaints with hearing loss, then we would advise a computed CT of this region. So we see these are the tests that we do.
Right. And should a person avoid swimming or bathing for a long time if, for example, they are having ear pain?
Yes. So ear pain with ear discharge means the drum is not all right. So such patients cannot dive, cannot use swimming pool. It's an absolute no, because the drum actually separates the external ear from the very sensitive inner ear, where it has a lot of things going on for our entire body. Like I said, the balance. So when the drum is not all right, when there's a hole, basically there's communication between this external ear and the inner ear. So any water that goes to this part goes to that part as well. So they can have a lot of infection, and they can have this giddiness, and even they can go up to brain fever and stuff. So we would say if the eardrum is not all right, your ear pain is very severe to the point that your eardrum is not intact or whole, swimming is an absolute no.
And can ear pain be a sign of a dental tissue, doctor?
So that's an interesting question. The nerve that supplies the dental joint also supplies the ear. Ear in the sense the external ear, skin, and a part of the eardrum. So it's just like a tree's two branches. So one nerve is supplying both the parts. So what happens when there is any dental infection and that particular nerve is getting irritated, it also transmits the pain to the ears. Sometimes the patient comes and says that they have ear pain. When we carefully examine them, they'll have caries tooth or they can have a dental infection, and that nerve can actually transmit the pain to the ear. Yes, yes, it can happen.
Okay, right. And is it possible that an ear pain is a symptom of a sinus infection?
Yes, again, sinuses, infection, there is nasal blockage, then the air from the nose will not reach the ear, then the ear goes back and back, retracts, then there is infection. Sinusitis is a very common cause of ear infection, if a long-standing sinusitis.
Okay. And how can a person tell that if his ear pain is related to ruptured eardrum?
Yes. So ruptured eardrum mostly gives ear discharge. I said initially, they can have frequent ear discharge. So they take bath and then they say the next 2 days, doctor, I had some sticky ear discharge. They travel somewhere far to a cold climate region, they'll have ear discharge. So when the drum is not whole, when there is a hole is there, so the air goes inside, the water goes inside, causes infection, brings out a lot of discharge. So if you want to know if your drum is not all right, the classical sign is you will have ear discharge. The next is the ringing sensation. You can have a ringing noise in the ear because of the air which is going in and out. The third can be ear pain. And finally, if it is a long-standing ear perforation, you can have hearing loss.
Right. And can ear pain be a symptom of a TMJ disorder, which is like a jaw joint pain?
Yeah. Again, the same thing that I said. So when we open our mouth and yawn, there is a joint here that moves. That is called the TM joint. We call it as temporomandibular joint. So that joint, again, it is related to the external ear. So if there is a lot of patients who undergo accidents on the road, they can have the TM joint dislocated or fractured. Such patients, there is no place for the joint to go anywhere. It directly goes into the ear because that is the next structure which is there. So that is the cause for the pain. The joint is very close to the ear, so anything that happens, the ear is also involved in that.
Okay. And how can patients or people differentiate between an outer ear infection and an inner ear infection?
So outer ear infection is very dramatic, I would say. There's a lot of ear pain, more in the night. Even for the adults, it is intolerable pain which wakes them up from the sleep. And sometimes there is discharge and the ringing sensation, all that. It's very dramatic. But the inner ear is very calm and silent, but it gives you weird symptoms like giddiness. You will have imbalance when you're walking, and giddiness with vomiting and hearing loss. So like I said, behind the drum is the inner ear, which deals with a lot of important functions like balance maintenance and hearing. A lot of nerves are there. So anything that happens to the inner ear has a serious set of symptoms like giddiness and hearing loss, while the outer ear has more of pain, discharge, things like that.
Understood. Right. So typically, what could be the potential complications, doctor, if a ear pain is left untreated for a long time?
So if the ear pain is left untreated for a long time, we can the drum can be ruptured. If the drum is ruptured, then there is more chance of infection of the inner ear and can go to the brain as well. They can have giddiness. The hearing will be gone. So it has to be treated early. There are two types of hearing loss. One is we call it as conductive hearing loss. The other is called as sensory neural, which involves the nerves. So it is better to get treated early, so that when we start developing this neural nerve-related hearing loss, you cannot bring the hearing back. So that is why ear pain can lead to symptoms like hearing loss, giddiness, things like that. if seen early, can be very well treated.
Okay. Right. So we've got a question coming in from a listener, Subi Suma, and they say, my brother met with road accident and head injury before 5 years. Now he faces now he faces hearing loss gradually. Scan reports are normal. Doctor says that scan reports are normal. What treatment can be taken other than hearing aid?
Okay, first of all, I want to know the age of the patient, because sometimes simply more than 50-year-old or more than 60-year-old patients can start having hearing loss, even there is with no history of previous accident. If there is a history of accident, sometimes there can be minute fracture lines which are rarely not seen in the CT scans. Sometimes a nerve can get involved in that. Age is 36. Okay, so can be a neural hearing loss when the nerves can be damaged, but the nerve damage will not be seen in the CT. They are very sensitive. There are different types of nerve damages. The first one is just the compression of the nerve, so they can have hearing loss because of that. I would advise if they go and show an ENT doctor, they'll just do a test called as audiometry, and they will tell you if it is a treatable hearing loss or it is a nerve hearing loss. So I think that basically differentiates.
All right. So he should consult a ENT doctor and get the audiometry test done. Right. Right. So I believe, Mr. Subi, please go through this, and I hope this will help you. In other cases also, you can come back to us with the further questions, and we'll definitely respond to you. Now, doctor, last question of the day: how can one relieve the pressure in the ear, that they feel the pressure in the ear?
Pressure in the ear, like for example, like flying. Is that what you asked?
Yeah, so typically when people get some kind of a ear pain, they feel some pressure in the ear as well. So how can they relieve themselves of the pressure?
So that kind of pressure, again, by chewing something, because the movement of the TMJ and then the air we inhale can go through the nose, can relieve some pressure. Sometimes simple wax, a lot of wax, hard wax sitting in the ear can also cause a lot of pressure. Most of the patients who say that I feel my ear is so heavy, and they come, then it will be a lot of wax sitting there, and then when we remove the wax, the pressure will be relieved. But I would advise, please do not try removing wax at home, especially with earbuds or things, because you are in a danger of pushing the wax or whatever in the ear more inside than causing any good from it. So I think we will, you will have, it's better if you come and see us, we'll help you.
Yeah. Right. So go see a ENT specialist doctor who can help you with cleaning of your ears and removing the wax. Because obviously at home, it is quite dangerous to use any sort of eardrops. It's a one-way passage. Would be so difficult for your ear to take all that, azole from that ear. And then, okay, one last thing coming in from Mr. Selvam. When I air travel, I get my ears blocked for the next 2 days. And during takeoff and landing, it hurts a lot. What should be done to avoid that?
Okay, so first of all, this problem that he says that the problem is not only during flying. He says the problem is there 2 days later also. Which means that the patient, he or she, should have a pre-existing nose or sinus problem, I assume, or sometimes people who smoke have very sensitive ears. So for them, this pressure during flying is extremely high. So such patients, like I said, that they should chew something or take a lot of precautionary things. Sometimes I even prescribe certain drugs. I see their eardrum before they travel. I give them certain nasal drops or sprays and some drugs to take before and after, which calms the eardrum during flying. I think if you see a doctor, we can identify if you have another coexisting problem which aggravates your ear pain during flying. That should help.
Understood. And Mr. Karthik is asking, how often should we use earbuds to clean our ears?
So that is a very wonderful question. I wanted to say, so using earbuds is very wrong. Using earbuds is very wrong. Please do not use earbuds. Even if the quality of earbuds is very amazing that you get from Johnson & Johnson also, please do not use earbuds. So our ears, God has created our ears so that it swirls around like a tube and brings all the wax outside if you leave it without touching. The moment we put a earbud or hairpin or anything, we stop the movement that God has given us and the wax gets all stuck inside. It will never come and one day you will end up with pain. So you leave the ears as it is, or please visit a doctor once in 6 months or a year to clean your ears regularly.
Right, right. So I'm sure Karthik would have got his answer, and it's very clear that you should see a ENT doctor and not try anything experimentation with your ear. It's very sensitive. So thank you so much, doctor, for today's session. I'm sure this is quite helpful for all our listeners. We'll be posting this Instagram live on the YouTube channel as well for the people to view this later as well. Thank you once again, doctor, and we do look forward to hosting you again.
Thank you. Thanks for the opportunity.
Wonderful. So guys who are listening to us, please do let us know in the comment section below which topic you want us to cover in our next Instagram live, and we will try our best to take it up with a specialist doctor. Cureka is, a team of specialist doctors who have founded online healthcare platform. It is now expanded to physical retail stores as well. Our the latest retail store opening in Indiranagar, Bangalore. Please do walk in if you are in Bangalore and do let us know how was your experience. And for the people who are across India, we've got people coming in from, nook and corners of India. For all your healthcare needs, you can be assured of buying the best products from Cureka. And if you have got any questions around your healthcare needs or concerns, we have got a free of cost WhatsApp platform which you can use. So with this, I would like to wish everyone a very, very happy and a safe weekend. Thank you so much, doctor. And we look forward to connecting with you again.
Thanks.
Thank you. Thank you, everyone. Take care.